Hi everybody, my name is Cole Zanetti. I'm a recent graduate of TCOM and I'm doing my family medicine residency at Dartmouth. I'm here to talk to you today about my Nana's story. Um, Last year when I was a fourth year medical student at TCOM, I had 1 month of vacation. And during that month of vacation, we kind of cram all of our interviews to get as much done during that time period as possible. Before my vacation started, I got a call from my mother saying that my Nana was in the hospital. Um, Unfortunately, I had to, the second I got off the airplane, I had to go right to the hospital to, to try to be there for her. Um, just to tell you a little bit about my Nana, she's about 71 years old. She is a chronic smoker and alcoholic. She has end-stage liver disease, and she was admitted for pneumonia. They were treating her pneumonia, but during the time she started having some heart issues, and she was moving around from one room to the next. Um, During that time, they neglected to change her IV line. It was a few days expired by the time I went and saw her on that first day. I addressed that with a nurse, and the excuse was that she was being moved from one room to the next, and it was neglected. It was missed. Um, During that time period, I tried to speak to my family about these things happen. Um, while I was in medical school, I studied quality improvement and patient safety issues, and I tried to articulate to my family that although this was an upsetting mistake, things like this happen, and these aren't bad people that do this. A few days later, after I had an interview, I went back to see my Nana, and at that point she really wasn't doing well. She was somewhat delirious, wasn't able to hold a conversation. She wasn't acting like herself. So we went and spoke to the healthcare professionals again and asked them what was going on. They started looking into it, and they realized that she was she wasn't giving important medication at the time. Uh, Her lactulose, which is what helped her deal with her end-stage liver disease, wasn't given to her for 4 days. Uh, the reason why was that it was lost in the shuffle of the paper chart. The order was never put in appropriately or put in an appropriate location, and she never received her needed meds for 4 days. My family was very upset again. Once again, I tried to quail that issue by explaining that these things happen. It was a system error, but it doesn't take away from the suffering that my Nana endured. I went to another interview, and during that time, my mother went to see my Nana. And when she walked in the door, she found my Nana crying in tears, writhing in pain because she was left in an extended position in a rehabilitation chair. Apparently, earlier that morning, a physical therapist went in to help with her exercises. At that point, she was in a bed for a month and she started to atrophy. So they were trying to work that out. The physical therapist got caught in the middle of trying to help another patient, so he got called to another room, and he forgot about my Nana. 2 hours went by, and she wasn't helped. Part of the reason why for that, in addition to the physical therapist leaving, was that her patient alert button was left on the floor where she couldn't reach it. Now that day, there was a snowstorm, and only one physical therapist was able to make it to that hospital. When he got there, he had all these patients that needed help, and he was trying to take care of them all. And unfortunately, in that mix, my Nana was left unattended. This infuriated my family. Having my mom walk in the room and seeing her 71-year-old mother in tears, crying in pain, is a pretty hard pill to swallow. We talked about it with the healthcare professionals again. filed a complaint. Um, but once again, this is becoming very frustrating to me because I'm a fourth year medical student. I'm somewhat aware of the healthcare field, and I've also studied patient safety and quality improvement. And there's still nothing I could do to help her. Went to go visit her again. And this time I was trying to really be supportive for my family and figure out what was going on, so we had a plan for how we could best care for her. One physician walked in and told my family and my Nana that her liver's not doing very well. We're going to have to keep her in for another week or two to make sure everything is going okay. About 5 minutes later, a second doctor walks in and says, "Oh, she's actually doing great. She might be able to go home today." The third doctor walks in about 5 minutes after him, and he said, "Oh, it's actually her lungs aren't doing that great, and we might have to keep her at least for one day." At this point, I'm infuriated. We had 3 different attendings that walked in about 5 minutes apart, and they're all saying 3 different things about what's going to happen in the next few days. None of them are talking to each other. When I brought this up to the last physician that walked in the room, they got defensive. They're in a rush. They had to see tons of other people, and the conversation was short. Let's put it that way. They're doing the best that they could in that situation, but the communication definitely failed. The next day, I had to actually fly back to Texas because my vacation was up. 4 days after that, I got a call from my pop-op. This was mid-January of 2011. It's about 3 or 4 o'clock in the morning, and he said that Nana passed away. Now, this was very difficult for me. My Nana meant a lot to me. She was a big part of the family, and this happened under my watch. I guess at that point I was very mad. I felt like there was nothing I could have done. There was too many fires going on at once, and I was trying to put them all out, but there was still nothing I felt like I could do. So I had a decision to make. I could remain frustrated, disenchanted by those events, or I could try to figure out a way to be a part of the solution to prevent these events from happening to other people, other loved ones. And that actually helped me make a decision on where I wanted to go for residency because of the importance of those values of team-based care, interprofessional training, patient safety. And those are key components to the interprofessional relationship. I guess why I'm telling you this story today is because I look to all of you as protectors of those loved ones. You're going from one location to the next, one rotation to the next. You see great system processes, and you also see horrible ones. You see failed communication and really well done team-based care. And I implore you to try to speak up when you see things not working effectively. I also implore you to seek out interprofessional training opportunities. These are essential to stop this stuff from happening. I really appreciate this opportunity to tell you my Nana's story, and I wish all of you the best of luck in the future. If you have any questions or concerns, ask Dr. Dolan for my contact information. Good luck.